I would want to thank everyone who has already started joining us even before the time. And I mean, it's just about a minute. We here today have Dr. Manish Gupta. He's a young, dynamic person, as we can see. His special interest is in lifestyle diseases of today, metabolic syndromes like diabetes, obesity, and thyroid related diseases. He's up to date with the latest in the field of diabetics. And Dr. Manish is very active participant in the CMEs and in the Trustees of Physician Forum and a member of the Committee of Family Physicians of India. Thank you, Dr. Manish, for joining us today. Um, we will
Glad to be here.
Yeah, absolutely. We would just want you to clarify all the myths which are there in the air, and there is so much that is going on, with COVID, and so much of misinformation being there in the social media, like through WhatsApp. You get to hear so many things, and people, because of the wrong information, are also facing the brunt of having some losses in the family and stuff like that, which is a very common thing. So we would just want you and your expert advice on specially related to, say, topics like diabetes and COVID, and then this new issue of black fungus that has already been declared as an epidemic in our country. So we would want to hear from you that what all is something that one should remember, what are the signs, what is it that people should be looking at before and after, or in between, while they are stuck by the virus. So thank you everyone for joining us today for this session. I am sure it is going to be beneficial for all of us, including me and people who are seeing it right now and who will be viewing it later as well. So, sir, I would like to begin now with the very first question, which is that what do you say is the importance of COVID, and what is it that we should be taking care of when somebody is diabetic and has COVID?
It's an excellent, important question. When the first wave hit us, or even before the first wave, there was a lot of hullabaloo in the media that if you're diabetic, the outcome will be worse. So diabetics, the outcome is likely to be worse if especially you are uncontrolled. And the reason being that in diabetics, the immunity is compromised. It is a pro-atherogenic state, meaning that it's more likely to have more clots and more myocardial infarctions. So therefore, if you get an infection like COVID, so that's probably might have worse outcomes, specifically if you are uncontrolled, you have had diabetes for long standing, right? So therefore, pre-COVID diabetes control is important if you by chance contract COVID. So that's why we as doctors have been shouting from March last year that to all diabetics that please be serious about your diabetes, please have it under control, be in regular touch with your doctors. Most of the diabetologists are doing teleconsults. They are available back and forth. People did wake up a little, but I think as we had with the whole of India, we kind of slackened a little with the after the first wave, and then again we kind of landed with the boom with the second wave. So namely, I will go point wise that diabetes and COVID is important, as we're seeing. Number one, because of fungal infections, or we call them opportunistic infections. If your immunity is low, any infection which is in the air or in the hospital setting, in case you are admitted, then you're likely to catch that infection. Number two, because of low immunity, you can have worse outcomes. The recovery will be longer because in diabetics, your immunocompromised status, as I'm saying again and again, so your recovery might be longer, and you can get many infections. So these are factors why, therefore, diabetes and COVID, you have to be really very strict about the sugar control.
And I'm sure, sir, I mean, this is something that everyone needs to understand, though diabetics are always said that, India being the capital of diabetes in the world, we need to be more careful, and that is why probably that is what is required. What is the role of medicines when it comes to, say, whatever medicines that is being prescribed for as a treatment for COVID? What is it? Is there any relation with diabetes?
Very nice question. Excellent question. See, in the first wave only, we kind of realized that steroids are going to play a big role, right? but the first wave in comparison to the second wave was very, very minuscule, right? So now with the second wave happening, uh, steroids suddenly became the life-saving drug. In fact, patients started on their own, right? Even being diabetics, or even some quacks out there started giving steroids from day one. So what happens with diabetes is that steroids normally cause a little bit rise in sugars. So if you're non-diabetic, your sugars won't cross the threshold levels. But if you are diabetic, maybe borderline, or if at all uncontrolled, then you're going to land in a soup. So the medicines prescribed for COVID, especially steroids, after day 5, day 7, can have an impact, a worse outcome on your sugars, and therefore COVID per se. So therefore, it is very important to be in touch with the doctor if you are diabetic and if you're going to be prescribed steroids.
And of course, I mean, people do understand. India has understood this even harder, that how it is important to be in touch with your doctor, especially with the pandemic. People are now becoming more and more serious. Is it?
Sorry, you went on mute.
I'm sorry. Is there anything that you would suggest that people could use as a preventive thing when they are diabetic and they get the infection? Is there something that could be preventive which they should be doing?
Preventive as in after the COVID infection or before the COVID infection?
Actually, I really wanted to ask both, but let's begin with somebody who has COVID. We know that 80% of people with COVID are just mild symptom. They're just getting mild symptoms these days.
Correct.
And about 10 to 20% of people are getting severe issues. So I just wanted to ask you if there is something that one should think or keep in mind if they are found COVID positive. Taking care of their medicines initially from the day one.
Yeah. So it is very good sugar control. For diabetics, it has to be number one, sugar control, and a good tight sugar control. By tight sugar control, we mean at all times sugar less than 180. So we want the sugars to hover between 140 to 180. Tighter the control, better maybe the outcomes, right? As most of the studies have shown in the past, pre-COVID era. But during COVID, we want it even to be even stricter, because your recovery will be better. Your body will fight the infection better. You're going to get less complications of COVID, right? So if you contract COVID, the seriousness will start from day 5, day 7 onwards, as we've been hearing, right? So everybody now knows about this. I don't want to repeat again and again about the cytokine storm and all those things. I'm sure everybody is now well averse. If somebody has question, we will, of course, we can take that up. But I don't want to waste the audience's time on the same thing again and again. But what we really wanted to drive home this point on this session was that with diabetes and COVID, please monitor your sugar more religiously for the next few days to get better outcomes, right? If they are not under control, get in touch with your regular diabetic doctor or your family physician or whoever has been taking care of your diabetes so far, so that even in the initial few days, it will have a better outcome once you contract COVID. If you don't get COVID and you are a diabetic, even then also you should control your sugars, because you are less likely to catch COVID, right? So your immunity levels will be good. So therefore, both the times, the answer is the same. Monitor your sugars better and have a very good tight control on them. Whether you use diet and exercise as number one, number two, and check your sugars. If they're not under control, talk to your doctor. Maybe they need to adjust the medications, make some fine changes in the diet here and there, but keep your sugars under great control. That's the bottom line. Pre-COVID, in COVID, or post-COVID, all three things, you have to have your sugars under excellent control.
Okay. And then there are so many myths about insulin being taken for during the COVID. And I know my father is a diabetic individual, so when his insulin was started, we were also a little afraid that what is going to happen. I mean, that was just for the time being that the doctor had suggested that. So there is a lot of negativity around having insulins. So how true or how false it is to say that if you are on insulin, you'll have to continue it for lifelong?
You know why I'm smiling is because this is my favorite question, because I keep getting asked this question a lot of times, even pre-COVID times. You know,
Very common thing, very, very.
right, exactly. So I tell people a very common answer, and I'm going to start with that. See, God made insulin in our body, correct? If insulin was bad, why would He create insulin? Why would He put insulin in our body, right? So if God has created insulin, it's only for a good reason, to control our sugar levels. Now in diabetes, the insulin levels have gone down. And as of now, there is no treatment to bring it back or kind of regenerate our cells or the factory where it's being made. So therefore, insulin is not the end of world, as was the myth, because earlier the patients would say, no, we don't want it. The doctor will say, okay, we will try it. So both will say, okay, let us kind of, push it. If insulin was an oral pill, okay, would we be afraid?
I don't think so.
Correct. So it's the best medicine. It's the best treatment of all the oral pills uh, to kind of control your diabetes. It's just that human mankind couldn't make it into an oral pill. So therefore it is in an injection form. Correct. And it's the most natural. It's there in your body already.
Yeah.
Right. And we have come so far down the time where insulins have changed from pig insulin, horse insulin to, bovine insulin. Now we have human insulin, which is very close to what we have in our bodies. So there is no chance of any allergic reactions or anything like that. Just a small, disclaimer here. Many companies are working on oral insulin tablets. So that day will come soon when we will have oral insulin tablets also, right? So insulin is not the end of the world. And if you are put on insulin during COVID, it's mostly to control your sugars better so that you don't get the infections. You kind of recover faster. And there is something called steroid induced hyperglycemia. So to counter that, the best medication are generally insulin, right? There are some certain other drugs which can be used, but generally if you are quite sick or if you're not too well, for the time being you will be shifted to insulin. And most likely after the steroids are stopped, you are going to be back on your oral drugs. But in some cases, we do see persistence of diabetes or high sugars beyond steroids being stopped or beyond, after COVID recovery. So there's a phenomena called COVID diabetes, because COVID virus does affect our pancreas also. So the insulin levels do get affected, but it's a new entity. Professor Shashank Joshi from, Mumbai and other, great stalwarts, Professor Anup Mishra, they all have been doing great work on COVID diabetes from since wave one. And they are saying that even if pancreas does get affected, it will recover. Okay, how much we don't know. So therefore, if you go on insulin, most likely it's going to be transient. But even if it becomes a little permanent, or even if the doses will come down, and we should not be scared of insulin. We should not be scared of insulin.
Okay, that's so much enlightening. I mean, I'm sure most of the people who had this query, they will have this answer ready with them. So are there types of insulin, as you just mentioned? So what are the types of insulin available in the market and what one should opt for?
Right. So I will not go too much into detail again. Because it will confuse the whole general public out there. But what I will try to say is that normal physiologically, insulin is secreted in two manners. There is one insulin which goes 24 hours without, no matter even if you don't eat anything. It is constantly in the body. It is being secreted at low level, at little high level, but it's just a peakless insulin. There is no peak to it. So next insulin, or the second type of insulin, is called a prandial insulin. The first insulin is basal insulin, okay, which is just at a kind of a stagnant phase. Next insulin is whenever you eat something, even a small apple or a chapati or a bread piece, there will be a sugar spike. To counter that sugar spike, the message will be sent internally, and the body will make some insulin to keep the sugars normal. That's called a prandial insulin. So we have these two type of insulins, a basal insulin and a prandial insulin, right? So a doctor would see how your sugars go, and then would use combinations. Either just use the prandial insulin just before the meals, or give you a long acting one which only controls the fasting sugars better. So that will be as per the sugar profile, as per the steroid drugs if they are used. So it'll vary from patient to patient, but the insulins have changed. There are newer insulins which can be even taken just with the meal, even after you have finished the meal, right? And they are faster acting. They are almost coming close to human insulins, what our normal insulins work like. So we are almost there at what our normal human body responds to a meal. To a meal, how the insulin is kind of secreted inside the body. We try to exactly copy that by giving you that type of insulin. If that makes sense. I don't know if I try to simplify it, complicate it.
It does. And I'm sure, I mean, because of the pandemic, I'm sure everyone has become this much well versed with the terminologies and all being used, you know.
Ji,
So
ji,
it's a blessing in disguise that way.
right.
I just had another thought which came into my mind right now is that the COVID this time in the second wave has affected a lot of pregnant women, and we have seen a lot of mishappenings with them. And of course, diabetes, gestational diabetes is not new to anyone. So, what is the recommendation for a pregnant lady, you know, in terms of say insulin and other diabetes
Yeah.
control
So
mediums?
the excellent question. So gestational diabetes, there are two drugs, mainly insulin. So the only drug which is safe during pregnancy, which has been studied, is insulin. There are a couple of more drugs, but there is some debate on that. So I won't kind of discuss that. But I will say that insulin is the main drug to counter the sugar rise. In diabetes, our sugar control is 90 to 140,
Hmm.
right? So it's even stricter than a normal diabetic, because so we have moved the bar even more strictly, that you have to check 1 hour after, and it has to be 110 120, right? So accordingly the insulin is kind of given. So therefore, even pre COVID, the parameters were very tight, because you are managing sugars for the well-being of the mother and the well-being of the child. There are two lives you're kind of taking care there. So therefore you have to have very strict control, right? And now on top of that, COVID, so you have to understand, and if you have to give steroids, so therefore the control will become even uh, more tightrope walk. But it can be managed. It can be managed. It'll only mean more and more monitoring, and therefore maybe finer adjustments will be needed to keep it into that tighter band.
This monitoring is again a very tough thing, you know. So is there anything, you know, I've always seen that everyone has to just prick their fingers and they can only do it, you know, twice, maybe once or twice a day, not more than that. Is there anything that has evolved in that field as well?
Yeah.
Is there
So
anything new which
yes,
is there?
yes, yes. And for last 5 years, it has the technology has changed. So there's something called the CGM, or the continuous glucose monitor, and there is a small different technology called the AGP, or the ambulatory glucose profile, which few companies have been making, not very expensive. So it is becoming affordable. Earlier it was not available to the general public. So there's a small sensor like this, okay, just like a coin shaped, which is put on the back of the arm, right? This is waterproof, can stay for 14 days, and track sugars every 15 minutes.
Hmm.
Okay, so now and that's the reader, right? This was the earlier the doctor only model, right? People had tough times to get their hands on this, but now we have the patient model, which has been launched recently by the company. So this is the patient model. All right, so this is available for sale now freely. All right, but slightly, this one is slightly expensive, but this was not roughly. But what I'm saying is that we have technology to make it prick free, and get the ideas. So it helps the doctor, it helps the patient realize if I'm eating wrong, if my insulin is wrong, or if my timings of meal are bad. So it really helps to really design the therapy, design tailor made the therapy for yourself. I'm sure I'm talking to Anytime Fitness India group here. So whenever any client comes in, you have to tailor make the physical whole kind of routine, right? For that person, there will be some general rules, all right, for your physical fitness, but there will be some people are ectomorphs, endomorphs, and other different types, right? So you have to plan that what kind of workout will be best. Similarly, if with this we do come to know that what's that person's lifestyle, how can we tailor make the therapy. So there are instruments like this which are available in the US, UK, for last 5 years in India also, it has been available, though the market penetration has been less because of cost factor, because of availability. The cost is still a little bit of a issue, but it is available for those who can afford it. I use it for my patients temporarily. So if you know somebody has been put on steroids or is going through a bad patch of glucose, I use it temporarily to help them track the sugars, learn about diet, and then kind of do the tailor-made therapy. Every doctor is now doing it. Most of the diabetic centers are using it with great success. Sorry
Is
if
it
I went
something
overboard on that.
Is it something that an individual has to have, like it is different for everyone? Like I need one for myself and
Yeah, just like a glucometer, right? So you have the strips, right? So you have to change your strips every time you kind of prick, right? So
yeah.
this is a sensor which is going to last you 14 days. So you'll have to buy a new sensor every 14 days.
And the unit remains the same. The glucometer.
The main
the
machine
remains the same.
There are now the technology has gone one step further, right? This you have to flash on top of this to see the readings come on this. There is a technology which is now coming in, which I've just started to explore. You can put a small device on top of this, and that will constantly via Bluetooth keep on emitting the sugar readings to your phone or your smartwatch, right? So even without kind of pricking, you will know what the alerts are. But that's more for type 1 diabetics, right? Those who need to keep their sugar levels all the time, they have to kind of, kind of monitor. But some of the hospitals in the ICUs did start to use this because they kind of realized that it was much more easier for the sisters, nurses, and faster way to keep a track of sugars rather than pricking 6 times a day or 8 times a day or every 2 hours in some of the serious cases. So therefore, it is being used in some of the hospitals as an add-on sometimes. Uh, the uh, the concern with this are basically two. The accuracy is a bit off, and it lags my blood glucose by 15 to 30 minutes. So you have to be astute, doctors, and we have to tell our patients that this is the drawback of this device. Any new technology will always have some drawbacks. Okay, when the cell phones came in, they were never perfect, right? So same with this technology. This is going to improve. I have heard that Apple Watch or the other companies are going to make sugar monitors in your watch. So kind of imagine. So that's the future. So we are going to have those devices very soon. So this is just a starting point, but this is available in India.
That is something. Someone who has very fluctuating diabetes and sugar level, for sure, they for them this might be a very useful tool.
Absolutely.
And in these times, I think information is something. Right information is something that everyone needs to manage the condition these days. Yeah. So I'm sure it is going to be helpful for them. Now we have got a few questions from different people. Yeah. So the first question is pertaining to how important is it for a diabetic person to do resistance training? I mean, exercise plays a very important role. So
yeah. Excellent question. So the American Diabetic Association and the American Association of Clinical Endocrinologists, the ACE, they did come out with that. So they found a mix of both endurance or cardio with the light resistance training helps. How? Cardiovascular will always help your heart and your lungs, right? So that is important for all. Light resistance training would work up the muscles and would improve the insulin action, or we call it insulin sensitivity at the muscle level. So the insulin resistance, which is a very important marker in specifically more of obese diabetics, that the light resistance training will help break the insulin resistance. So therefore, for improving the action of what your body is making the insulin, a combination of both is the perfect workout routine.
Okay. Yeah, and in terms of say diet modification, I think people are everyone now understands how important diet is for managing diabetes as well. So what is the recommendation in terms of diet management to people, especially after COVID and before that?
Excellent question. There are a lot of myths. We can have a huge a different session, maybe, 4 or 5 sessions, even just on diet and diabetes. But I'm going to just, sum it up in a small thing, what I tell practically my patients. See, if your body's insulin is less, you might even simply eat an apple, your sugars will spike to 400. Okay, so diet is not everything. It is important, but it is not everything, because every diabetic thinks, okay, I'm eating wrong, that's why it is going so high. Yes, you could be eating wrong, but in spite, if you think my diet is okay, which is, if your carb content is in low to moderate, right, increase the veggies content, which is fruits, veggies, salads, and which have low calorie and low glycemic index, then you're doing okay on your diet. You can do any of the fancy diets, the ketos, the intermittent fastings, they all help. But you have to understand, whatever diet you choose is not temporary. It has to be a lifelong change which you have to bring in. If somebody says, I'm going to eat this multigrain thing, I love, I have heard this, fair enough, do it. But you have to understand this change. This diabetes isn't going anywhere. So that change, whatever you bring in your diet or exercise, has to be easy for yourself so that you can maintain it, right? So therefore, the myths are so many, right? So we can go on, and as I said, there is a huge debate on it. So science is learning. I will just end this question by saying that in 2021 we have realized, and more with these kind of devices, is that everybody's body responds differently to different foods. All right. So what we have said, that earlier the rule was, for example, diabetics should not take mangoes. Okay. So yes, that was a general principle, but maybe your body can digest it better in a lower quantity. So how will I know? Check your sugars 1.5 to 2 hours after the cheat meal and see if it spiked up, right? If it didn't spike up, probably that cheat meal could be okay. So therefore, if you kind of track different foods for you, right, you could know yourself, be your own dietitian, right? Slowly, with those concepts coming in, that, okay, this I have to do lifelong. So please make it easy and simple for yourself. Don't make it tough on yourself, because we sometimes as doctors, we put, too much pressures. We give, so many diet advices. The patient is already overburdened. He's already, oh my God, I have diabetes. And on top of that, so many rules, we have to make it easy, make it pleasantful, because that person has to live with diabetes for the rest of his life. So therefore, we have to make it easy for yourself, for the person who's going to be with you, who's going to be assisting you. So I that's what I tell my patients. Sorry.
I guess the key remains with consistency, things that you can do and change in your lifestyle. That will play a major role in terms of having better results with diabetes and living a better life with diabetes as well.
Absolutely.
One thing that just came to my mind was that I wanted to ask you is there anything that a person with diabetes should think about while going for vaccination, or there's nothing that one should be thinking?
Right. So there have been myths. Many of my patients have asked, sir, I have 300, can I go for vaccination? Well, you didn't take care of 300 till now. So, what does one day 300 do? So you have to understand that one day sugars will not impact anything, right? So it is, if I say, okay, no, we will control your sugars first, get your HbA1c to less than 7 or 6.5, you have to wait for 3 months before you can get your vaccination. No question in this pandemic. All right. So therefore, in this pandemic, vaccination is a priority, irrespective of your diabetic status. Of course, if you're too sick, if you have, if you're too weak, if you've gotten some recent illness, then better postpone that. But as per se, high sugars are not a contraindication unless you have some infections or you are sick at that moment. There is no contraindication for vaccination.
Okay, that's great. I mean, people have a lot of, they had a lot of myths earlier as well. The vaccination has now improved. I mean, the number of people getting themselves vaccinated has for sure increased. But I guess I've heard people asking these questions that I am diabetic. I don't know whether I should be, why should I go and infuse myself with the virus when I'm safe inside house? So I'm sure they will now understand that it is an utmost important thing.
Absolutely.
We've got one more question, which is about, are the risks different for people with type 1 and type 2 diabetes?
Excellent question. Risk for COVID. I hope that person means that. Right?
I'm assuming that it is related to COVID only.
Correct. So type 1, type 2, we are talking of the sugar levels. So even in type 1, if your sugars are uncontrolled, you are at higher risk. If you're type 2, sugars high, you are again at risk. Both type 1, type 2, good sugar control, less risk, right? Better the outcome, better the immunity, less chances of mucormycosis or the black fungus.
Yeah, right. Of course. I mean, that brings me to another question, which is about mucormycosis. I mean, this is related to diabetes.
Mostly seen in diabetics.
Yes. So it was there earlier as well.
See, the fungus is in the air.
Yes, yeah.
The fungus didn't come out of nowhere.
Yes.
Right. So you have to understand that. So fungus is there in the air.
And everyone has to make sure, all the diabetic people, especially who are at higher risk for it, they should make sure how the family should be supporting. As in, once they are back from hospital, we've heard that a lot of cases people went back and then they got mucormycosis.
Yeah, so excellent.
What management should be done at that point?
I think it is a good question. Our science is, learning on it. So number one is if that person is diabetic, tighter control of these sugars.
Sugar levels.
Number one.
Yes.
Number two, our science is now realizing probably long-term steroids after recovery, we should try to taper them off early. Okay, but that will always be left to your treating doctor. If he or she feels, no, you have had a really bad case of COVID and you need steroids for long term, so you need steroids. Steroids per se will not cause black fungus. Steroids will only lower your immunity. How do I increase my immunity? So most of the black fungus or the mucormycosis will happen in the nose and throat cases. So if I kind of hydrate myself well, if I keep the rooms aerated well, if it's a sunlit room, some scientific data is coming on, though I haven't read the papers. Maybe a small amount of betadine diluted, betadine gargle solution could be put in the nose and nostrils if you're comfortable with that. Deep breathing exercises would help to kind of aerate that area, right? Air exchange, as we do the air exchange outside in the rooms, same thing if you have good, ventilation of our system. So therefore, deep breathing exercises would help, right? But again, the point comes to if you have good tight sugar control, right? That will be most paramount to you not getting black fungus. Yeah, next point, last point in all of this is that the water in the oxygen humidifier, though some data is saying if the fungus cannot grow in that water just like that. So maybe my advice would be change the water, more frequently. You could use distilled water. You could simply boil the water, cool it, and then kind of put it in that. Will that help? If the fungus isn't in that area, it won't just come out of that water into your nose, right? So again, you have to understand that there have to be factors which will let the fungus grow. There has to be, it's like leaving a bread outside. Okay, if you leave a normal bread outside, the fungus won't grow on it. There have to be factors for the fungus to grow on that bread. So just imagine the same scenario in your nose. It has to be wet. It has to be lying outside for long, right? In a poor ventilated area, in a poor sunlit area, then only the fungus will grow. So the same factors is really exactly what's actually going on here. So if we can counter that by deep breathing, by ventilating our surroundings, by having a sunlit area, making sure our water in our humidifier is changed. You could use betadine, but again, I don't want to pass it on as a kind of a general recommendation. It's more a hit and trial, all those things. Some people do the simple, jalnetis, right, to kind of wash the sinuses. So anybody who has, recurrent sinus issues, they should take more care. Would steam help? Again, it's a humidifier. So would that help here? No harm per se, but again, the data and the studies are not there. So the science would say aerate the area, ventilate the area, keep your sugars under control. I think that's the thing we have to prevent mucormycosis.
Of course. And as this, this disease is actually unfolding in various ways, so something or the other is also coming up. And I'm sure in future we will have more of research and database things.
Data is less right now. Right now, the science is kind of learning.
There's another question by Mr. Kamal Kumar. He's asking, I'm not diabetic. Last month, I tested positive for COVID and during the treatment had steroids for 10 days. He took dexamethasone 6 mg for 10 days. Will it have effect on my sugar levels? What are the symptoms I should look for? And can we take regular sugar medicines with COVID? I think this is separate. So this is what his question is, that what will it affect my sugar level and what are the symptoms I should look?
I think with the this is the outfall of the WhatsApp and the media creating on the sugars, right? So please don't be scared. All right, dexamethasone was given for 10 days, right? If you're non-diabetic, you are very unlikely, and if your sugars didn't go high during that time, very unlikely that you will become diabetic, right? And if you don't have any family history, if you don't have any family history of diabetes, you are unlikely to get diabetes. So please be at ease that it's very unlikely that you will get diabetes from eating steroids for 10 days. We give steroids for many conditions long term. For example, rheumatoid arthritis. There are many other autoimmune conditions where we use steroids long, 1, 2, 3 months, 6 months, right? There we think, okay, now diabetes might come in, right? So for 10 days steroids, if you did not get diabetes during that time, there's no family history, it's unlikely that you will develop diabetes because of steroids, right? 10 days steroids would not cause you to become diabetic unless you have family history, you were diabetic earlier, or you were on the borderline, right? Your HbA1c is 6.5, and all that. And because of steroids, kind of short up.
Okay, there's another question about medicines. Can we take regular sugar medicines with COVID medicines, which include steroid?
Absolutely, absolutely. Be in touch with your doctor, discuss with them. This is of paramount importance because of steroids. If being given during COVID, the doctors might need to increase the medicines a little and might give, if the sugars go too high, then insulin temporarily. So be in touch with the doctor, and answer again comes back to check, and check.
Yes. Does moderate drinking every day affect sugar level? If yes, how to control sugar level? Very nice. Somebody.
Right. So this is one of the common myths I get asked. So to understand that by drinking, I hope he means liquor only.
I'm
right?
sure.
So 30 ml of any whiskey has about 65 calories. Okay, so you have to understand that I have to now distribute my calories in the whole day. So a diabetic should go up to, according to weight, 1200 to 1400 calories in the whole day. So roughly 400 to 500 calories in one meal, roughly. So now you have to kind of do the maths that how much am I going to drink and what I'm going to eat with it, with the snacks. So what happens with alcohol is that it has empty calories. It's going to give you calories and then make you hungry.